Good morning, ladies and gentlemen. I'm News 8 digital anchor Luke Laster here from the Wood TV Live Desk. The Integrated Services of Kalamazoo has been awarded a grant of $550,000 to help fund mental health response services for local law enforcement in Kalamazoo County. Joining me this morning, the coordinator of the Connect and Protect Law Enforcement Behavioral Health Responses Program, Lindsay O'Neill. Lindsay, good morning. Thanks for taking some time. How are we this morning?
Good morning. Thank you for having me. I'm doing well.
You bet, you bet. So a few questions here just to kind of get us rolling. First, tell me about your role and then the Connect and Protect program overall.
So I am a program supervisor with Integrated Services of Kalamazoo, our local mental health agency. I work specifically in the Corrections and Recovery Unit, and we focus on individuals involved in the criminal justice system that are also working with our mental health programs at ISK.
And then the grant itself, this coming together, obviously that's a huge sum of money. How did that come about?
So that actually came about a year ago. Many of the local law enforcement leadership approached ISK and asked if we could partner and start working on collaborations for responding to calls for service that were more mental health in nature. We took some time and looked at some initial data that really showed that our community had a significant amount of calls coming into our 911 and dispatch center that were mental health in nature or crisis related. And so we determined that there was a partnership that could be created with that. Around the same time, the Bureau of Justice Administration released multiple grants to establish these collaborations, and we applied for the Connect and Protect one.
When tracking that data of those specific calls, what is it that's deemed a mental health call? Like what kind of nature do those kind of calls entail?
So this is actually a very complicated factor to determine, and one of the areas that we plan to address with this grant. Currently, all of our calls come into the Kalamazoo Centralized Dispatch Authority, and then they filter those out to the different local law enforcement agencies. There is not, at this point, a system in pulling that information out that determines all of the calls that are mental health related. And so what we did is we went in and really tried to determine based on keywords and phrases and ways that calls were documented to determine how many of those calls. When those numbers came back, about 5% of the 911 calls contained those mental health terms. However, again, because there's no uniform system, we really feel that that number is low representation of what's really coming in. We determined that in 2019 to 2020, there were 30,000 calls total that appeared to have a crisis related in nature.
So a multitude of agencies involved here. I mean, aside from, Kalamazoo itself, Portage, Vicksburg, everything, Richland, Augusta, even in, Western Michigan University there. How did getting every single one of these specific cities and towns involved, how important was that to actually have everyone in, Kalamazoo County involved with that?
We felt that was vital to this project and has been a message that, I've really stood by, is that every single law enforcement agency in our county is involved in this in one way or another, as well as, again, centralized dispatch. And as the grant goes on and we build our strategic plan and we develop the programming, we'll definitely be even pulling in more partners. But just to have every law enforcement agency be willing to come to the table and to be really willing to send their leadership to help determine what these programs are has really been vital in this. And we wouldn't be able to do this without the involvement of every single department.
Could you explain some of the existing programs that are already there? We were told here that several of those existing programs will complement what we have here with the PMHC. Could you explain some of those specific ones?
Yeah, we currently have a few programs and partnerships that we work on within the county. The first is through the county sheriff's office. We do have a jail diversion program. We have 2 full-time clinicians there working with individuals who have already entered the system and are in the county jail. Through Integrated Services of Kalamazoo and my department, we also run a mental health recovery court, so a diversion program for individuals with behavioral health diagnoses that have found themselves in the criminal justice system as well. We've been working with Portage, Department of Public Safety since back in 2013, 2014, and even before then, doing a co-responding model where we provide 4 to 8 hours a week of follow-up services with them. And then we're also involved in our countywide crisis intervention, which is a local law enforcement week-long training for officers in the field learning how to work with people who are in crisis or have mental health or substance use diagnoses.
What's a timeline of kind of how quickly we could see this grant getting put to work?
It's a 3-year grant. We are already into the first year. The first year is really spent doing reviewing of that data, doing strategic planning, and determining what's going to be best for our county in these response programs. Year 2 and 3 then builds on that and has a little bit more of the implementation and the activities that will be created based on what our council and our strategic plan outlines as the most important areas to address.
What do you hope to see kind of here within the next, we'll just say 3 months, three to 6 months? What do you hope to see kind of the first thing of this grant, again, getting put to work?
I hope to see really through our review of the data and our review of other models and programs that already exist throughout the country that we're able to create a sustainable, innovative program that will help to improve the quality of life of everyone in Kalamazoo County, not just those receiving services, but those providing those services, those living and working in our community, and that we create a sustainable program that lasts long beyond this funding will be there.
Lindsay, we really appreciate your time. Is there anything else that you'd like to put out there surrounding this grant?
I really think that covers it and just covers how excited we are to have this partnership and this collaboration and to move forward in this time.
Awesome. Lindsay O'Neill, ladies and gentlemen, thank you very much for your time there. Folks, there's a link actually to the stream here. If you want to click on that, it'll take you over to woodtv.com. You'll be able to watch our full conversation here. Again, if you tuned in halfway or if you missed it and want to watch it there. So this has been a look at the Wood TV Live Desk. I'm News 8 digital anchor Luke Laster. Folks, have a great morning and we'll see you around.